A report published by Minnesota Department of Health in 2018 states that Minnesota's STD rates are on the rise. Infections included in this data are chlamydia and gonorrhea. The report states that a majority of chlamydia cases are confirmed in people aged 15 to 24. Similarly, 15 to 24-year-olds hold 42% of gonorrhea cases in Minnesota. And this is devastating news because these infections are almost completely preventable using established prevention methods. Young people are failing to use prevention methods, and lack of education may be to blame. As a teen, I did not receive comprehensive sex education and even less STD prevention education, so I feel very close to this issue. With the information I present, I hope to convince you that Minnesota schools need to increase their STD prevention education. Today, I will discuss first why we need more STD prevention education. Second, how we can meet that need. Third, what it will look like if more STD prevention education were available. And finally, how you can take action. Eugene Hall, a PhD candidate of the U of M, states in a 2018 article posted on Minnesota Psychological Association's website that without quality sex education, Minnesota students are at higher risk for STIs, unplanned pregnancies, and risky sexual behavior. He also states that requirements for Minnesota schools regarding sex education are a sex ed curriculum must be taught, it must be comprehensive, technically accurate, and updated. These vague requirements allow school districts to omit important information, including STD prevention. The 2019 Minnesota Statute 121A.23 programs to prevent and reduce the risks of sexually transmitted infections and diseases states that schools must have a sex ed program that has a curriculum that includes helping students to abstain from sexual activity until marriage. A 2007 study by Lawrence Feiner, published to Public Health Reports, found that by age 20, 75% of participants have had premarital sex, and by age 44, that percentage goes up to 95. This data shows that abstinence until marriage is not working in our communities. It is clear that there's a need for increase of STD prevention education, and now I will discuss ways to implement that education. There are many opportunities to further educate people in STD prevention. In the classroom may be the easiest way to implement this education. Putting a priority on STD prevention within the sex ed curriculum may be the easiest way to directly access the students most at risk. There is also an opportunity for community outreach programs. These programs would be led by medical professionals who wish to educate our students beyond the abstinence is the answer idea. These programs would be funded by education funds because these programs would be in place to educate our youth. With a more focused STD prevention education in classrooms or community programs, we will likely see a change for the better in the future. STD rates would begin to decline soon after these programs were implemented, and these STD rates would continue to be low in the future because the students would retain this knowledge. Beyond the lower STD rates, there would also be a reduction in the cost of sexual health expenses and care. There are many benefits to increasing STD prevention education, but in order for that to happen, we need to take action now. Every person has a voice and can advocate for this cause. Some methods to do so include contacting your local school district and asking how they handle sex education and STD prevention education. You could also sign a petition that look to increase education on STD prevention. And a petition I recommend is on change.com and is called Students Enforcing Required Sexual Education Courses to Prevent the Spreading of STDs/STIs. You could also contact the Board of Education and ask for better education relating to sexual health. Finally, you could also contact your policymakers and encourage them to require more STD prevention education within our school systems. In conclusion, I first discussed the need for more STD prevention education. Second, how we could implement this education. Third, what it would look like if more STD prevention education was available. And finally, I showed you how we can all make it happen. With better education, our state can begin to reduce their currently increasing STD rates. And with lower STD rates, our communities will be healthier and safer.